viewers, welcome to the Editorial Analysis by Drishti IAS. In this section, we regularly take editorials from various newspapers and news portals for a better understanding of various issues happening in India and around the globe. Dear viewers, in this section, we first try to link the editorial with our UPSC syllabus. Then we go analytical in order to understand some key points and at last some important concepts. Dear viewers, we truly hope that you like this initiative taken by Drishti IAS and your feedbacks are important for us. So kindly feel free to give your important feedbacks in the comment section. So without any further delay, let's commence our session.
Dear viewer, this video is available in Hindi as well. If you wish to watch it, please visit our Hindi YouTube channel, Dristhi IAS. For your convenience, the link for this video in Hindi has been provided in the description below.
Today's editorial is taken from the Indian Express, published on 27th of January 2021. The title of today's editorial is Keep the Vigil. If we try to summarize today's editorial, we can say that the results of Sero survey in Delhi are reassuring, but the virus is unpredictable. There is no room for complacence. If we try to link today's editorial with our UPSC syllabus, we can link it with GS Paper 3, which has sections that include science and technology, environment, and biodiversity. Some key points from today's editorial. The results of the latest round of the Sero survey conducted in Delhi confirm what many health experts and scientists have been saying for some time now, that the prevalence of Covid-19 in the population has reached a level where the dynamics of herd immunity can be said to start playing a role. Now, as per the results of the latest Sero tests that were conducted in Delhi, the results are quite good and they are according to what exactly many scientists and doctors have been saying for some time now. All these people have repeatedly said in the last 2-3 months that now we have reached that stage where the population has actually developed herd immunity against the COVID-19 virus. It is also said that such a level of herd immunity will now start playing a very important role. Now, before we move ahead, it is quite important to know about what exactly the Sero survey result was and what exactly the Sero survey is. The Ministry of Health and Family Welfare on Monday decided to conduct a population-based Sero survey in selected districts of the country with an aim to monitor the trend in the prevalence of the SARS-CoV-2 virus, which causes the COVID-19 disease. Now, what exactly the Sero virus or Sero survey is? A Sero survey involves testing of blood serum of a group of individuals, and this will be used to monitor trends in prevalence of the novel coronavirus or SARS-CoV-2 infection at the district level. The surveillance is conducted by the Indian Council of Medical Research and the National Center for Disease Control in collaboration with key stakeholders and state health departments. The facility-oriented surveillance is an expansion of the testing of flu and serious respiratory cases in hospitals being carried out by the government. Now, what exactly the results from Delhi showed? Now, like we all know that it was the 5th round of serological surveillance that was conducted in Delhi, and it has suggested that more than 50% of those who are surveyed have developed antibodies against COVID. This is the highest seroprevalence found during surveys conducted by the Delhi government since the COVID-19 outbreak, and according to experts, it indicates that the city is moving closer to achieving herd immunity. Now, when we are speaking about herd immunity, now what exactly the herd immunity is? So herd immunity basically is a resistance to the spread of an infectious disease within a population that is based on pre-existing immunity of a high proportion of individuals as a result of previous infection or vaccination. So viewers, this was something with reference to the Sero survey, the results of the Sero survey that were conducted in Delhi, and the idea of herd immunity. Now let's move ahead. The results indicate that in at least 50% people in Delhi, they have actually developed the herd immunity. So far, only Pune has reported similar number in serious surveys that were conducted way back in September. Now, Delhi has become the second city after Pune where it has been said that almost 50% population has actually shown a great amount of resistance by developing a very strong herd immunity against the COVID-19 disease. The present scenario, in a situation where a vast majority of infected people exhibit few or only mild symptoms, a high disease prevalence rate can be reassuring. Now see, we know how actually corona behaves. Sometimes there are people who show symptoms of the disease, symptoms of cough, symptoms of fever. But there are many people who are asymptomatic, but yet there is the presence of the SARS-CoV-2 in. So among such a situation where a disease has got such a situation where patients can be both symptomatic and asymptomatic, when we see that a high disease prevalence rate is present, it is something that is quite motivating. This could be one of the more important reasons why the spread of the disease has slowed down considerably in the last few months, leading to a steady decline in the number of cases that are detected. And it should be noted that because of this high disease prevalence rate, we can say that the reduction in the number of cases that are now being found because of corona, they have also started to reduce. If we look at the statistics of the past 3 months, the COVID-19 cases are decreasing day by day. So this steady decline can be contributed to a high disease prevalence rate in corona. But it is important to remember that these results do not give any reason to believe that the epidemic is over or that the whole population has achieved enduring immunity. Now, most important thing that we should not forget that even though the numbers are quite motivating, we should not forget that the epidemic is not over yet. We don't have to be complacent. It is not a situation where the entire population has developed an enduring immunity. Now, enduring immunity, it actually here means to the immunity for one particular disease that is present in the entire population. We haven't achieved that status yet. So, there is no scope for being complacent. And this is because one key detail is still missing. How long does the immunity gained through natural infection or through vaccination last? Now, the biggest question is, we have achieved a high disease prevalence rate, no doubt. We are seeing that cities have developed over 50% of herd immunity. Again, that is something which is very motivating. But the biggest question that still lies in front of us, that for how long this immunity will stay in the body of a person, which they have gained either through the natural infection or through some kind of vaccination. So just like the start of the vaccination drive must not bring complacence and prompt the abandoning of masks or norms of physical distancing, so must not the results of Sero survey, how reassuring they can be. So like we all know that everywhere the government is also saying, though the vaccination drive has started, the pandemic is not over yet. So we don't have to be complacent. We do not have to forget using masks. We have to always maintain social distancing. So even the government is saying that even after vaccination, for some time, we have to carry on with these processes. And same is the case with the results of the Sero survey. Though the results are quite motivating, quite appreciating, yet there is some very important information which is missing. And that is for how long this immunity will actually remain, how long this immunity will prevail in the body of a person. The way forward, at the same time, the government must undertake some more Sero surveys in many more places. This is only way to know what might be happening on the ground beyond the numbers revealed by testing. Now, government has to take this initiative to even more places, and government has to bring more people into such Sero surveys where exact numbers can be found, or we can see what exactly is happening at the ground level. The last round of the countrywide Sero survey by the Indian Council of Medical Research was conducted in July and August. After that, individual research groups have been conducting in some major cities. In the absence of such data, the reasons for spectacular decline in the number of cases that has happened since the middle of September will not be understood, nor the bewildering numbers that continue to be reported from Kerala for the past 3 months. See, there are two absolutely opposite cases here. On one side, countrywide, we can see that the number of cases in corona, they are declining, they are reducing. But if we look at Kerala, the number of COVID cases that are coming, the numbers, they haven't declined as they were supposed to. In fact, we have seen that the numbers have started increasing. So we have to actually be very sure about the natural immunity that the people have gained, whether it is through the vaccination or whether it is through the natural infection. We cannot be complacent, and that is the need of the time. It will not be known either why the trajectory of the epidemic has been so different from that in many other countries in the world. Reliable and transparently obtained data can help scientists and health experts to assess the situation better and improve preparedness for the future. Now, only thing that we have to focus upon, and we have to provide to our doctors and scientists and health experts, that the data has to be reliable and transparent, because only such a help can actually ensure that what exactly is the current situation, and also it will give the important information required by our scientists and health experts to be better prepared for the situation that might come in the future. So viewers, this was something with reference to today's editorial analysis. Now, with reference to today's editorial analysis, some preliminary questions that can be framed can be based upon: number one, they might ask you what exactly herd immunity is. They can ask you about the enduring immunity. They can also ask you something about the ICMR. Okay, and along with that, they can definitely ask you what exactly Sero survey means. So viewers, I hope you liked today's editorial. Thank you very much.